All right, welcome back for another deep dive. Today we're going to be tackling something that affects, well, everyone.
Hmm. It,
Hypertension, high blood pressure.
yep.
We're going to be looking at excerpts from a medical surgical nursing textbook, and we've also got some research from the American Heart Association.
Sounds good.
So get ready to really unpack the science behind blood pressure,
Right.
uncover the risks
Yeah.
associated with hypertension, and discover some practical tips for prevention and management.
That's right. Yeah, we're gonna try to demystify this often silent health threat.
So first things first, what exactly is blood pressure?
Well, in the simplest terms, blood pressure is the force of your blood against your artery walls.
Okay.
It's kind of like, thinking of water flowing through a hose.
Okay.
The narrower the hose, or the more water you pump through, the higher the pressure.
Makes sense.
And it's governed by a formula: blood pressure equals cardiac output
Okay.
multiplied by peripheral resistance.
Okay, so the heart's like the pump and the arteries are like the hose,
Yep.
but I imagine it's not always that straightforward, is it?
Right. It's a little more complex than just a pump and a hose. Several factors come into play, including the heart's pumping strength,
Hmm.
the volume of blood circulating, and even the constriction or relaxation of your arteries. Things like age, body size, diet, even your emotions
Hmm.
can make a difference in your blood pressure readings.
I've definitely noticed, like, my blood pressure goes up if I'm feeling stressed or something.
Yeah, that's a common experience. It just goes to show how dynamic this system really is.
Okay, cool. Now, when we get our blood pressure checked, we always get two numbers.
Right.
What's the difference between systolic and diastolic pressure?
Well, if you can imagine your heart cycling between squeezing to pump blood out and then relaxing to refill, the top number. Systolic pressure represents the peak pressure when your heart contracts,
Okay.
and the bottom number. Diastolic pressure represents the pressure when your heart is relaxed.
So systolic's like the boom of the heartbeat, and diastolic's like the pause in between.
That's a good way to visualize it. There's also something called central aortic systolic pressure,
Hmm.
or CASP, which measures the pressure at the very beginning of the aorta.
Okay. Why is CASP important? Is it just another way of measuring blood pressure?
It's more complex to measure it, but it gives us a more accurate understanding of the pressure that your vital organs
Okay.
are experiencing. And this can be crucial for doctors to personalize your treatment plan.
So it's more targeted information. Okay, all right. Now let's shift gears and talk about hypertension itself. Why is it considered such a serious health concern?
Hypertension is often called the silent killer because it can be asymptomatic for years, while silently damaging your blood vessels
Okay.
and organs, increasing your risk of heart disease,
Mm.
stroke, kidney failure.
That sounds pretty scary. What blood pressure reading officially puts someone in the hypertension category?
A consistent reading of honored 40, over 90 millimeters of mercury or higher.
Okay, good to know. Are there different types of hypertension we should be aware of?
Most cases are classified as essential hypertension, meaning there's no single identifiable cause.
Mm-hmm.
It's likely a combination of genetics, lifestyle factors, and other elements.
Okay.
We're still researching.
So kind of a mystery cocktail of factors there.
Yeah.
What about the cases that aren't essential hypertension?
Those are classified as secondary hypertension, so meaning the high blood pressure is caused by an underlying condition,
Gotcha.
like kidney disease, hormonal disorder, and it's essentially that primary condition
Yeah.
that triggers the high blood pressure. We also sometimes see white coat hypertension,
Yeah.
where blood pressure spikes just due to the anxiety of being in a medic setting.
It's interesting that, even our mental state can affect our blood pressure readings. Speaking of things that can impact blood pressure, let's talk about risk factors.
Absolutely. We can categorize risk factors into two groups: modifiable
Okay.
and non-modifiable. Non-modifiable factors are things you can't change, like your age,
Mm,
family history,
okay.
ethnicity.
So those are things we just have to be extra vigilant about.
Exactly. But the good news is that modifiable risk factors are within our control.
Okay, good.
Things like diet, physical activity, smoking, alcohol consumption, and even stress management
Hmm.
can significantly reduce your risk.
That's encouraging.
Mm.
Sounds like taking ownership of your lifestyle plays a big role in preventing and managing hypertension. Now, I know hormones are involved in regulating blood pressure. Can you explain how this complex system works?
Well, think of your kidneys as the blood pressure detectives in your body.
Okay.
They're constantly monitoring blood pressure. By sensing the volume of fluid passing through, if they detect a drop in blood pressure,
Mhm.
they signal the release of an enzyme called renin.
That's fascinating. What happens after Renin, enters the scene?
Renin sets off a chain reaction
Mhm.
called the renin-angiotensin-aldosterone system, or the RAAS.
Okay.
And this intricate pathway ultimately leads to the production of a powerful hormone called angiotensin II.
I've heard of angiotensin II. Isn't that the one that, causes blood vessels to constrict?
Yes, angiotensin II is a potent vasoconstrictor, meaning it narrows your blood vessels to increase blood pressure.
Hmm.
And it also triggers the release of aldosterone from
Definitely.
the adrenal glands and antidiuretic hormone, or ADH,
Okay.
from the pituitary gland.
So angiotensin II really sets things in motion.
Yeah.
What do aldosterone and ADH do?
Both of these hormones work to regulate fluid balance.
Mm.
Aldosterone tells your kidneys to reabsorb sodium back into the bloodstream.
Mm.
And wherever sodium goes, water follows, boosting blood volume and further increasing blood pressure.
Huh.
ADH tells your kidneys to hold on to water, making your urine more concentrated,
Gotcha.
increasing blood volume.
So aldosterone's pulling in sodium and water. ADH is retaining even more water. And then angiotensin II is also stimulating thirst to make you drink more. That's a lot of teamwork.
Exactly. It's a highly coordinated effort to maintain a healthy blood pressure. But what happens when the system goes awry and blood pressure stays elevated? For too long, that's when we enter the territory of hypertension and its potential complications.
Stay with us as we uncover the serious consequences of uncontrolled hypertension
Mm-hmm.
and explore what you can do to fight back. So before we were talking about the intricate RAS pathway and how it regulates blood pressure, but what happens when this system gets out of whack and we're dealing with chronic high blood pressure?
Yeah.
What are the consequences?
Well, that's when things can get pretty serious. Over time, uncontrolled hypertension puts a tremendous strain on your arteries, your heart, other vital organs,
Okay.
leading to a whole cascade of health problems.
Yeah, it's like, driving your car with the parking brake engaged.
Yeah.
Eventually something's gonna give.
That's a great analogy. Yeah, that constant pressure from hypertension damages the lining of your blood vessels,
Mm.
making them more vulnerable to atherosclerosis, which is the buildup of plaque that hardens and narrows the arteries.
And atherosclerosis increases the risk of serious cardiovascular events like heart attacks and strokes.
Exactly. The heart has to work so much harder to pump blood through those narrowed arteries, leading to an enlarged and weakened heart muscle. This increases the risk of heart failure, where the heart just can't pump efficiently enough to meet the body's demands.
So it becomes like a vicious cycle.
Yeah.
High blood pressure damages the arteries, the heart's overworking, and then the heart weakens further.
Yeah.
Are there other organs at risk besides the heart?
Absolutely. High blood pressure can also wreak havoc on your kidneys, impairing their ability to filter waste products from your blood. This can lead to kidney failure, which is a serious condition that often requires dialysis or even a transplant.
So we've got the heart and the kidneys taking a hit from hypertension.
Yeah.
Any other organs affected?
Unfortunately, yes. High blood pressure can damage the tiny blood vessels in your eyes, leading to vision problems, even blindness. It can also affect your brain, increasing your risk of stroke, cognitive decline, and dementia.
Wow. So it really is like a whole body issue. It's incredible how something like high blood pressure, which often has no symptoms, can have such widespread and serious consequences. How do we even know if we have hypertension, especially since it's often called the silent killer?
That's why regular blood pressure checks are so crucial. Even if you feel perfectly healthy, having your blood pressure checked regularly is the best way to catch hypertension early. Sometimes the first sign of trouble is a hypertensive crisis, which is a sudden and dangerous spike in blood pressure.
So what should people be on the lookout for? Are there any warning signs or symptoms they should be aware of?
While many people don't experience any noticeable symptoms, common ones include severe headaches, dizziness, blurred vision, nosebleeds, shortness of breath. In more severe cases, you might experience chest pain, fatigue, or even seizures.
So those are serious red flags. Like if anyone is experiencing those, particularly suddenly or severely, it's time to seek immediate medical attention.
Absolutely. Don't wait to see if it goes away on its own. Early detection and treatment are essential in preventing long-term damage.
Okay, so what happens if someone gets their blood pressure checked and it's high? What are the next steps? What kind of tests are used to confirm the diagnosis and assess the impact on the body?
Doctors use a variety of tests to evaluate hypertension and its effects. An electrocardiogram, or ECG,
Okay.
assesses the heart's electrical activity and can reveal any abnormalities
Mhm.
caused by high blood pressure.
Yeah, I've had an ECG before. It's very simple and painless.
Yes, it is. Another common test is an echocardiogram, which uses sound waves to create a picture of the heart's structure and function. This test can show if the heart muscle has been enlarged or weakened
Hmm?
due to high blood pressure.
So ECG is showing electrical activity. Echocardiogram is showing structural changes. Any other tools that are used to kind of assess that damage from hypertension?
Blood tests are also important. They can be used to evaluate kidney function
Hmm.
and check for other potential causes of hypertension. Sometimes doctors may order more specialized tests, but the goal of all these tests is to get a comprehensive picture of your cardiovascular health
Okay.
and how hypertension might be impacting your body.
Okay, it makes sense that doctors would use a variety of tools to evaluate a complex condition like hypertension.
Mm.
So once a diagnosis is made, what can people do to manage this condition? It's not just about taking a pill, right?
You're right. Managing hypertension involves a multi-pronged approach
Okay.
that combines lifestyle modifications with medication.
So you mentioned earlier the DHH diet. What makes it so effective for lowering blood pressure?
The DHH diet, which stands for Dietary Approaches to Stop Hypertension, focuses on a balanced eating plan
Okay.
that emphasizes fruits, vegetables, whole grains, lean protein, and low-fat dairy,
Hmm.
while limiting saturated fat, cholesterol, and sodium.
That sounds like a healthy and delicious way to eat.
Mm.
What else? What else can people do to make lifestyle changes that support healthy blood pressure?
Another crucial change is reducing sodium intake.
Okay.
Too much sodium causes fluid retention,
Hmm.
which increases blood volume and drives up blood pressure. Time to put down the salt shaker and read those food labels carefully.
Okay, less salt. Got it. What about exercise?
Regular physical activity is key. Aim for at least 30 minutes of moderate intensity exercise on most days of the week. Things like brisk walking, swimming, cycling, or anything that gets your heart rate up.
Okay.
And we can't forget stress management. Chronic stress can contribute to high blood pressure. So finding healthy ways to manage stress, like meditation or yoga,
Hmm.
can also help.
Yeah, it's all about taking like a holistic approach to well-being.
Hmm.
Recognizing that mind, body, and blood pressure are all connected. These lifestyle changes are great, but are they enough to manage hypertension for everyone?
While lifestyle modifications are incredibly important and can be very effective for some people,
Okay.
many others will also need medication to get their blood pressure under control.
Okay, so let's dive into the medications. What are some of the different types of antihypertensives that doctors use?
There are several classes of medications that work in slightly different ways to lower blood pressure. One common class is ACE inhibitors, which we talked about earlier in the context of the RAAS pathway.
Right,
They work by blocking the production of angiotensin II.
right. So they prevent the formation of that powerful vasoconstrictor.
Ex-
Are there any downsides to ACE inhibitors that people should be aware of?
Some common side effects include a dry cough, dizziness,
Mm.
and fatigue. It's also important to note that ACE inhibitors can interact with certain supplements.
Okay,
So always discuss any supplements you're taking with your doctor.
good point. Always good. Clear communication with your healthcare provider.
Yeah.
What other types of medications are commonly used to treat hypertension?
Another class is calcium channel blockers.
Okay.
These medications work by slowing the movement of calcium into the cells of the heart and blood vessels,
Hmm.
reducing the heart's workload and widening the blood vessels,
Okay.
which leads to lower blood pressure. And then there are beta blockers,
Yeah.
which block the effects of epinephrine, also known as adrenaline.
Hmm.
They essentially slow down the heart rate and
Right.
reduce its force,
Okay.
lowering blood pressure.
Beta blockers are like chill pills for the heart.
Exactly. Now, while these medications can be very effective, it's important to remember that they can also have side effects.
All right.
Some common side effects of calcium channel blockers and beta blockers include dizziness,
Okay.
headache,
Hmm.
nausea, and fatigue. And it's worth noting that certain calcium channel blockers can interact with grapefruit juice.
It seems like grapefruit juice interacts with a lot of medications. Always a good idea to to check with your doctor or pharmacist about potential food and drug interactions. Now, are there other types of antihypertensive medications besides ACE inhibitors, calcium channel blockers, and beta blockers?
Yes, there are. We also have ARBs, or angiotensin II receptor blockers.
Okay.
Instead of preventing the production of angiotensin II, like ACE inhibitors do,
Hmm.
ARBs block its action by
Oh,
preventing it from binding to its receptors in the blood vessels. This effectively blocks the vasoconstricting effects of angiotensin II.
okay.
Then there are selective aldosterone receptor antagonists, or SARAs, which work further down the RAAS pathway by directly blocking the action of aldosterone,
Okay.
preventing it from promoting sodium and water retention. And finally, we have direct renin inhibitors,
Okay.
which, as the name suggests, directly inhibit the enzyme renin,
Hmm.
the very first step in the RAAS cascade.
Wow, it seems like we have a whole arsenal of medications to choose from, each one working on a different part of that blood pressure regulation system.
Yeah.
I imagine finding the right medication for each person is a bit of a puzzle.
You're absolutely right. Choosing the right medication depends on many factors, including the severity of the hypertension, other medical conditions,
Mm.
potential drug interactions, and individual patient preferences.
So it's definitely not one size fits all. I imagine it takes some trial and error to find the right medication and dosage.
That is often the case. Working closely with your doctor to find the most effective and well-tolerated treatment plan is essential. They can help you navigate the options and make adjustments as needed. Now, we've talked about essential hypertension and various medications,
Right.
but what about those more severe forms of hypertension you mentioned earlier?
Yeah.
Accelerated and malignant hypertension.
Yes, let's talk about those. What makes them different from regular hypertension, and why do they require immediate medical attention?
Accelerated hypertension is characterized by a rapid and significant increase in blood pressure, typically accompanied by signs of organ damage, particularly in the eyes.
What kind of eye damage are we talking about?
We might see things like hemorrhages,
Mm-hmm.
which are areas of bleeding, and exudates, which are fluid leaks from damaged blood vessels
Got-
in the retina. These can be detected during an eye exam and are a warning sign that blood pressure is dangerously high.
So if someone's blood pressure is like skyrocketing and they're experiencing vision changes, it's time to get to the hospital.
Absolutely. Time is of the essence in these situations. Untreated accelerated hypertension can quickly progress to malignant hypertension,
Okay.
the most severe and life-threatening form.
Okay, let's talk about malignant hypertension. How does it differ from accelerated hypertension, and what makes it so dangerous?
Malignant hypertension is essentially accelerated hypertension that has spiraled out of control. Blood pressure reaches extremely high levels, often above 220 over 120 millimilli Hg.
Wow.
And there's evidence of severe organ damage, especially in the brain,
Okay.
kidneys, and heart.
Those are some seriously high numbers. What kind of damage are we talking about in those organs?
In the brain, there's a high risk of stroke, seizures, and even coma.
Wow.
The kidneys can sustain damage,
Hmm.
leading to acute kidney failure,
Yeah.
and the heart can become severely overworked, leading to heart attacks and heart failure.
Yeah, it sounds like a medical emergency where every minute counts.
You're exactly right. Malignant hypertension is a race against time. Immediate treatment is needed to lower blood pressure and prevent irreversible organ damage.
So what does treatment look like in these emergency situations?
Yeah.
What do doctors do to bring blood pressure down quickly?
The goal is to rapidly lower blood pressure using intravenous medications, often in an intensive care setting. Some commonly used drugs include diazoxide,
Okay.
nitroprusside,
Hmm.
nitroglycerin,
Okay.
and labetalol. These medications work quickly to relax blood vessels and reduce blood pressure.
So it's like a rapid response team for your blood pressure, working to bring it down as quickly and safely as possible.
That's a good way to think about it. And in addition to medications, supplemental oxygen may be given to ensure adequate oxygen delivery to the vital organs.
It's amazing how quickly things can escalate with hypertension, from a silent condition to a life-threatening crisis. It really emphasizes the importance of regular monitoring and early intervention. Now, earlier you mentioned the important role nurses play in managing hypertension. Can you elaborate on that? What are some of the key things nurses do to help patients?
Nurses are truly on the front lines of hypertension management. They provide a wide range of care, from close blood pressure monitoring
Okay.
to patient education and support.
Huh.
They're often the ones who identify early warning signs, educate patients about lifestyle modifications, and administer medications.
So they're like the coaches and the cheerleaders for patients navigating the challenges of hypertension.
That's a great way to put it. Nurses play a crucial role in empowering patients
Okay.
to take ownership of their health
Hmm.
and make sustainable changes.
What are some specific ways that nurses monitor blood pressure?
One tool they frequently use is the automatic blood pressure recording machine.
Hmm.
This machine takes multiple readings at set intervals, providing a more comprehensive picture of blood pressure patterns than a single measurement.
It's like having a 24/7 blood pressure diary.
Exactly. And this is especially helpful for patients with labile hypertension,
Okay.
where blood pressure fluctuates significantly
Hmm.
throughout the day. Having that continuous data helps paint a clearer picture for more effective management.
That makes a lot of sense. And earlier you mentioned the importance of patient education. Can you share some of the information that nurses typically provide to their patients?
Nurses cover a wide range of topics, including the importance of taking medications as prescribed, strategies for incorporating lifestyle modifications, common side effects of medications, and the warning signs that require immediate medical attention.
So they're really a valuable resource and advocate guiding patients through their hypertension journey.
That's right. They work tirelessly to empower patients with the knowledge, tools, and support they need to manage their condition effectively.
We've covered so much ground in this deep dive, from the science of blood pressure regulation to the complexities of diagnosis and treatment. It's clear that hypertension is a serious condition that requires a comprehensive and proactive approach.
You summarized it perfectly. We've explored the intricate interplay of hormones and fluid balance, the devastating impact of uncontrolled hypertension, and the array of strategies used to manage this, often silent,
Right.
but potentially deadly condition.
Before we wrap up, what are some key takeaways for our listeners?
Knowing your blood pressure numbers is crucial. Regular blood pressure checks are essential, even if you're feeling perfectly healthy.
Right.
Early detection is key to preventing long-term damage.
Absolutely. And remember, high blood pressure isn't a life sentence. There's so much you can do to take control of your health.
Exactly. Lifestyle modifications like weight loss, sodium reduction, regular exercise, and stress management can make a significant difference. And for many people, medications can effectively lower blood pressure and reduce the risk of complications.
It's all about finding the right balance
hmm
between lifestyle changes and medication tailored to your individual needs and guided by your healthcare team.
You've got it. Remember, knowledge is power when it comes to managing hypertension. The more you understand about your condition, the better equipped you'll be to make informed decisions
Hmm.
about your health.
So for our listeners who are ready to take charge of their blood pressure, where should they start?
The first step is simple. Talk to your doctor. Get your blood pressure checked, discuss your individual risk factors, and work together to create a personalized plan that addresses your unique needs.
It's like embarking on a health adventure with your doctor as your guide and nurses as your trusty companions.
What a fantastic way to put it.
Yeah.
Remember, this isn't a solo mission. Lean on your healthcare team.
Educate yourself and stay proactive. Your heart will thank you for it.
We hope you've enjoyed this deep dive into the world of hypertension. We've barely scratched the surface,
Hmm.
but hopefully you've gained some valuable insights and a renewed sense of empowerment.
It's been a pleasure sharing this journey with you. We encourage you to continue exploring and learning. There's a wealth of information out there, and the more you know, the better equipped you'll be to take control of your health.
And don't forget to join the conversation on our social media platforms. We'd love to hear your thoughts, questions, and any personal experiences you'd like to share about managing hypertension.
Until next time, stay curious, stay informed, and stay heart healthy.
We've been on quite the journey, exploring hypertension.
Mm.
It's amazing how much we've learned about, that delicate balance
Yeah.
within our bodies and the impact it has on our overall health.
It really is remarkable how interconnected everything is.
Yeah. And before we were discussing the vital role that nurses play in managing this condition, from monitoring to education to support, they really are instrumental in helping patients navigate this complex condition.
Speaking of monitoring, you mentioned a specific tool that nurses often use, the automatic blood pressure recording machine.
Mhm.
Can you tell us a bit more about how that works and why it's so helpful?
Oh, these machines are fantastic because they give us a more dynamic view
Hmm.
of a patient's blood pressure.
Okay.
Instead of just a single snapshot, they take multiple readings at set intervals,
Okay.
allowing healthcare providers to track trends and identify any concerning fluctuations.
So it's like having a 247 blood pressure diary.
Exactly. And this can be especially helpful for people with labile hypertension, where blood pressure can swing up and down throughout the day. Having that continuous data, it helps paint a clearer picture for more effective management.
That makes a lot of sense. And we can't forget the critical role that nurses play in patient education. What are some of the key things that they focus on when helping people understand and manage their hypertension?
Nurses are like walking encyclopedias
Yeah.
of hypertension knowledge. They cover everything from the importance of, taking medications exactly as prescribed
Right.
to practical strategies for making those all-important lifestyle changes. They even discuss potential side effects of medications and those red flags that warrant immediate medical attention.
Wow, it sounds like they provide incredibly comprehensive support and guidance.
They truly do. They're amazing advocates for their patients, ensuring that they feel empowered to take ownership of their health journey.
Well, we've covered a lot of ground today, haven't we?
We have.
We've gone from understanding the basic science of blood pressure to exploring the potential consequences of uncontrolled hypertension, all the way to delving into the various ways we can manage this condition. It's clear that knowledge is power when it comes to taking charge of our cardiovascular health.
Absolutely. We've seen the intricate workings of the RAAS pathway, the devastating effects of unchecked high blood pressure, and the arsenal of tools and strategies available to fight back.
Hmm.
What stands out to you as the most empowering takeaway from our deep dive today?
I think what resonated with me most is that realization that we don't have to just passively accept a hypertension diagnosis.
Right.
There are concrete steps we can take
Yeah.
to protect our hearts and our overall well-being.
I couldn't agree more, whether it's through, lifestyle modifications, diligently taking prescribed medications, or simply staying informed and engaged with our healthcare providers. We have a real opportunity to make a difference. It's about taking an active role in our health journey.
So for our listeners who are ready to take that active role and prioritize their blood pressure, where should they start? What's the first step?
The most important step is a simple one. Talk to your doctor.
Okay.
Get your blood pressure checked. Have an open conversation about your individual risk factors, and work together to create a personalized plan that meets your unique needs.
It's like embarking on a health adventure with your doctor as your guide and your nurses as your supportive travel companions.
What a fantastic way to frame it. Remember, you're not alone in this journey. You have a whole team of healthcare professionals in your corner, ready to guide and support you.
That's a great note to end on. We hope this deep dive into the world of hypertension has been informative and empowering. Remember, knowledge is the first step towards making positive changes.
We encourage you to keep learning and exploring. There's a wealth of information available. And the more you know, the better equipped you'll be to manage your health.
And don't forget to connect with us on social media. We'd love to hear your thoughts, your questions, and any personal experiences you'd like to share related to hypertension.
Until next time, stay curious, stay informed, and most importantly, stay heart healthy.